Welcome, everyone, to Women of the Military podcast. I'm here with Trish, and you probably think she's going to be my guest, but she's already been on the podcast. Actually, she's been on the podcast twice, once to tell her story, once to interview me, and now she's back again to interview me again. I went through the process of getting registered with the VA and then going through my disability claim, and one of my other friends recommended I talk about that experience. And so here we are. So thanks so much, Trish, for being here and for interviewing me. So I'm handing the reins over to you. I'm a little afraid.
So this is one of my favorite things to do is to pop onto your podcast because it is, I get to listen in the car. I'm on the road a lot as a photographer. And so I catch up on all the podcast episodes, but it's fun when I get to turn the tables and ask you questions. And I know one of the things that you brought me on here to discuss today was, again, that the VA healthcare experience. VA, for those of you that don't know, stands for the Veterans Administration. And I don't know about anybody else who's listening, but for me, I really wasn't familiar with this process. I know that they touch upon the VA, everything that it has to offer, but it was like rushing through a whole menu or buffet of benefits as we're going through TAPS class, right? Transitioning out. And I know I'm not the only one who's had this experience because I talked to other women veterans, especially those of us who are also military spouses. And we don't think that we really need it or that it applies to us because we're still military dependents of an active duty spouse. Now, for Amanda, what did you understand about the Veterans Administration when you left the military?
Yeah, I had a 2-hour long briefing about everything related to the VA. And the funny thing is, the biggest thing I remember was that if you knew a veteran who died, you could get like the special letter from the president. And I'm like,
Yes.
why is that what I walked away from the whole like 2-hour spiel about the VA? Because I think that part was like the easiest part to understand because there was
Mhm.
so much at you and so many acronyms that everything was just like soup, and that was like the only thing that I realized or that I could walk away with, and it was easy and not complicated. And I'm like, that really doesn't help me because that's for after you die. And so yeah, that was my experience. I didn't and I knew that there was 5 years of free VA healthcare for women, and I knew they had started a program, but like you, I am a
Mhm.
military spouse, and so I was like, "Why do I need that? I have healthcare." And I
Yes,
didn't
exactly.
understand why that was important, and I didn't look into it.
So when did you actually start looking into it?
So I went to the um veteran Ginger's conference, the diversity inclusion, the women veteran. It's interactive. They have a
Oh,
conference every year in November
that
to
Ginger
high.
Miller puts together, yes.
Yeah, Ginger Miller puts together. She's been a guest on the podcast. And so I went to that conference and people started talking about like the VA and
Mhm.
disability and registering, and I that was the first time that I had heard about it, and they had some people to help you with a disability claim, but at the time, I didn't think that I had any reason to file a disability claim, and I
Mhm.
just wanted to learn how to register, and people seemed to be talking a lot about the disability stuff and not the registration, and so I felt really confused and overwhelmed. And also, this was like 5 years. I got out in October. It was 5 years and 1 month after.
Oh,
Yeah,
no. Yeah.
5 years and 1 month, and at the time, before the PACT Act changed it to 10 years, that was, like, the window to get in to register, and so then I felt like I had screwed up and missed my chance, and really just was, like, wondering, "What way can I get into the VA system without having to serve in the military?"
Oh, wow. So, yeah, it's interesting that many of us learn about different benefits that we're entitled to as veterans when we're just a day late and a dollar short is the best way to put it.
Yeah.
That's when we find things out. Now, did you have some else or something that you've identified as a disability or something that you saw in your records or something that came out later that convinced you needed to go back and actually take a closer look at VA healthcare?
Yeah, I realized that the trauma I experienced from my
Mhm.
deployment that I needed to get that looked at, and then also when the PACT Act came out, am a s- I had skin cancer in
Wow.
2019, and I found it really early and was able to get it removed. I still like kind of freak out because it happened in September, October of
Mhm.
2019 was when I found it, and then it was removed like a couple weeks later, and it was stage 0 melanoma, and so
Very lucky.
melanoma, yeah, I'm so, especially with the pandemic and, like,
Mhm.
doctor's offices being closed and, um, all the stuff that happened in 2020, I'm so thankful to God that I was able to find it and have it just be something that was like a minor annoyance, because it really was just getting to the doctor's appointments that
Mhm.
made it happen. And so I knew that was a presumptive, so I really wanted to file my claim for that. And then I also, as I worked with my VA rep, he helped me make sure that I have a hole in my eardrum that I got
Oh, wow.
while I was on active duty, um, and minor hearing loss, and so those were the main things that we looked at for the claim.
So when it going back, for the things that you said, you had a hole in your eardrum and hearing loss were two of the things that happened on active duty. Was that documented in your medical records while you were on active duty?
Yeah, well, I had surgery while I was on active duty,
Okay.
because they found the hole while I was deployed, and there was a lot of drainage and a lot of issues with that, and so I had surgery, and that fixed, like, 99% of the issues that I had. Like, I don't have drainage anymore,
Mhm.
I don't have pain very often, but every once in a while I do, and they were able to, so now you can't even see the hole, but when you do the test, it doesn't get the
Filled it.
pressurization like it's supposed to.
Yeah.
So,
And the other thing that you mentioned was presumptive conditions. Can you just explain a little bit more of what presumptive conditions are and what that means?
yeah, so for both the PACT Act and then even if you go back to, like, Vietnam, there's certain diseases or cancers or different things that if they happen, even like, I got out in 2013 and the skin cancer was in 2019, but because I was in Afghanistan and you just have to be in the region, 'cause a lot of it's due to the burn pits, and so I was like, "How close to the burn pits do you have to be?" And they're like, "In the country." And so if you're in the country,
Mhm.
then you get that disease or cancer or anything. Like, I know there's a lot of people who have asthma post
Mhm.
military service, and that's a big one. And so if you go through the list on the PACT Act and like Vietnam veterans and you find that you have one of those, you can file your disability claim, and you know that you'll at least get 0% for whatever that is. And 0% allows you to get into the VA system if you've missed your 5-10 year window. And
Mhm.
it also allows you to go, like, I have my appointment in November to do my follow up for my skin check. So I have all my health care related to anything dermatology with the VA now.
So now it's documented. So if
Mhm.
anything changes in the future, you have the right to the benefits that you earned.
Exactly.
All right. And I know you mentioned PACTA. Many of us have received that letter from the VA that talks about registering with the burn pit registry, especially if you've been in, many different areas of conflict and theaters of operation. You're right about the anywhere in that country, in
Right.
any of those countries. How does that burn pit registry relate to the PACT Act? And for the PACT Act, what exactly is that? So that
So
you
the
might clarify that, yes.
Yeah, so the PACT Act, actually I did a podcast interview about it. I should have looked
Mhm.
up the number before, but I'll make sure to put it in the show notes so that people can find it easily. But I did it last October, and last summer, not this past summer, but the summer of 2022, uh, veterans advocated on Capitol Hill to get the PACT Act passed, and it changed so many things. It's like I did a whole podcast episode and I'm still learning more stuff about it. So it's like I can't
Mhm.
really explain it in a quick blurb, but it changed things for post 9/11 veterans. It's really it's kind of like what they advocated for Vietnam veterans after the Vietnam War, and were able to get all those, diseases and cancers and everything that Vietnam veterans were facing a lot because of Agent Orange, and this is because of the burn pits and other different things that happened in Afghanistan. And so it changed so many things, a list of too many things long of like, but all the things that veterans today are facing, challenges because of that. And it also extended that five, remember I was at 5 years and 1 month, and they changed it to 10 years. And so, which actually is, let's see, what month is it? September. My 10
Yes.
years is October
Oh my
of getting
gosh.
out of the military. So I was able to register with the VA even before I did my disability claim. And because I wasn't capped by my income, I was able to get into the VA system very easily, and well, sort of easily. I did it online, but then I had to go in person and do it all over again.
Oh no,
So,
what?
like,
It just the system overloaded or
I like, the systems don't really talk to each other. So, like, I got into the VA, I got a letter from the VA that I was, like, in, and they assigned me to, one of the clinics, but
Mhm.
then I found out that clinic didn't have a center for women, so then I ended up
Oh,
going to
okay.
Long Beach. And so I don't know if it's because, like, I picked not picked the wrong, but I didn't pick the VA that had a center, and I wanted to switch, if that's what it, but it all worked out, I got in the system. But that would be, I guess, my recommendation if you, like, do the online program because it'll tell you if you're eligible, but
Mhm.
it then you'll probably have to go in person. And even when I wanted to go to my first appointment, that's they were like, "You have to go to Long Beach because 'cause they're our head VA office for the LA area, and all the ones that are closer to my house are satellite." And so I had to go in person to the VA. So I kinda recommend going to the large VA hospital in your area and registering with the real human, even if you're past the 5 or 10-year window, because they can help you and they can actually, like, explain to you the rules instead of, I kinda regret not ever taking any action and just being like, I disqualified myself by, like, just saying, "Oh, I missed the 5-year window." I
Mhm.
Instead of going to the VA and talking to a person and having them tell me no, instead I just said, I messed up, I should have gone." And then
Mhm.
I just waited, so that would be my advice.
And so I know you did so much of this listening to this your story, you did so much of this on your own. But there are people that can help you through the process, whether it's filing a claim or, as you said, going in person to one of the larger VA hospitals or clinics and actually talking to a human. So, learning from this experience, and you gave a little bit more your advice of actually going in person. But are there other organizations like VSOs or veteran service organizations that you can go to get some help to get through
Yeah.
this process?
I don't know for registering. I don't know if they can help you with the registration because the registration, it's really simple online. You just
Mhm.
fill out, your information, and it's really, and it was the same forms that I did in person. So for registering, I don't think that they're like, maybe you could talk to someone at like the VFW or the American Legion, or Wounded Warriors even. There's different, like, disabled veterans. There's so many
Mhm.
organizations. But I actually, when I was trying to file my claim, I knew I didn't want to do it on my own, and I really struggled to find someone. I emailed my local American Legion, I never heard back. I
Oh,
emailed my
wow.
local VFW, I never heard back.
Mhm.
And I don't know if it's because it was the LA area and it was like right after the PACT Act and they were just overwhelmed. But I ended up emailing a friend in DC and said, "Do you know anyone who could help me?" And she was able to give me someone who was able to help me with my claim. And if someone's looking for someone, I don't want to like blast his information out here, but you could always email directly and I would be happy to pass on his information because he was able to help me with like all the paperwork and get everything filed.
Well, that's great to know. It's nice to know that, as you demonstrated, that sometimes just reaching out to our veteran community and just letting everyone know that we're looking for assistance, that we're going to find somebody who can help
Right.
us that has actually been through this process or helped others get through this process. Now, on
Yeah.
top of having an individual walk us through the process of either filing a claim or getting involved in VA healthcare, do they also offer a class? that extends
Yeah.
beyond the blast we get from taps, but an actual class that goes through a more of a deep dive through what VA healthcare benefits are, especially for women.
Yeah, so I did attend a class last December, and I know they're not offering it now, but they're gonna be offering it again, probably in the late winter and spring of next
Mhm.
year, and so I'll definitely share it, but I went to it was supposed to be 4 hours, it ended up going over, like, 4 hours and 30 minutes, and it was only about VA healthcare. It wasn't
Oh,
about VA disability, it wasn't about the GI Bill, it wasn't about home loan, it was only about healthcare, and it was scheduled for 4 hours, and you'd think it would have ended early, but no,
yeah.
it ended late, and I had to leave early. I stayed for 4.5 hours. It wasn't over, people were still asking questions, but I had a meeting that I had to go to, and I actually left the training in tears because
Oh, no.
I thought I had missed my chance. They didn't have the updated information about the 10 years, and,
Mhm.
like, they showed, like, the income qualifications, which you they're really they need to be updated, they're really low, especially if you live in LA, California, they're,
Oh,
like
yeah.
they're, like, insanely and they're nationwide, so it doesn't matter if you live in Ohio or LA, you have
Which
to
makes
make
no sense, right?
yeah.
Yeah.
And so I was like, "We make way too much money.
Mhm.
I'm never gonna get healthcare," and I just learned about all these benefits that I don't need today, but, as I get older and
Yes.
as, like, my health declines, um, then I'm not gonna have access to it because I didn't register, and I was really upset because I felt like it wasn't fair that just
Mhm.
because I didn't know that I was supposed to do something, that I wasn't going to be able to get my benefits, and so I was really upset. I actually started my next meeting crying because I was just overwhelmed by, like, what I had like, the information I now had and I felt was
Mhm.
totally useless, but I also was crying and felt that, "What the heck? I'm gonna apply." So it finally got me to apply, and then I was able to, get registered with the VA, and so yeah. But there's so much to offer within the VA healthcare system, and I had no idea, and I spent a 4-hour class, I should know everything, and there's still
Oh,
so
no.
much more to learn.
Yeah,
Yeah.
we've discovered that you can never get everything at once because even if they do cover it, there's only so much that we can actually absorb, right? Where we'll have to go back and
Yeah.
check and actually look through. And you're right about getting in there and registering within that period just in case something happens down the road. Because I think there are quite a few of us that actually are even out of that 10-year window. From what you've experienced, is there anything that those of us who are outside of even that 10-year window can do at this point?
If you're outside the 10-year window, I would recommend talking to someone who a VA represent not someone who can help you file a disability claim, because if you
Mhm.
get a disability rating of 0% or higher, then you don't have to worry about the income levels, and that can get you in. So, if you're past the window, you
Mhm.
can look and see, like, do you have hearing loss? Do you have, pain in one of your legs because of, if you can work with someone and, like, go through and find, a disability, or if you have a disability and you
Mhm.
need to do that claim, that would be the thing that I would do, because then once you get rated at 0%, then you can get that rating allows you to get VA healthcare.
Now,
And
how
disability and healthcare are separate. So
okay, got
you
it.
have there's more like, once you get your rating, then you have to go and talk to healthcare so that they know it's not as easy as you get your rating, you're in healthcare. It's like, now you
They
have your
don't just talk
rating.
to each other.
No, they don't.
The
They're silo.
responsibility.
Yeah.
Okay, so the silo, got it. So we have to jump from one silo to the other. So there's still a lot of onus on ourselves to make sure that
Yeah.
we're advocating for ourselves, that we're looking for that information to make sure that we understand the process as we go through. And if our questions aren't answered, to keep asking them and find
Yeah.
out, keep working until we find the person that can actually answer our questions.
Yeah.
So I mean, that is a lot, and it can be intimidating for many to even start on this process, but it is
Yeah.
worth it at the end. Now, for
Yes.
those of us who are, again, are also military dependents, spouses of active duty members, how does having that access to VA healthcare while also having access to Tricare, what's that benefit?
So so I think the benefit, at least for me, so I went to the doctor in LA at the Air Force Base Clinic or Space Force Base, whatever they want to call it. I went to the clinic on base and I met with my doctor and he literally just checked my pulse. And when I asked him questions about like should I be screening for breast cancer because I'm getting closer to 40, he told me, well, the age has changed to 45, and I was like, yeah, but I'm a veteran. And he didn't seem to like understand why that mattered and like that I had
Oh, wow.
deployed. And so he also he didn't suggest doing blood work. So like it was like my yearly appointment, and maybe some bases are better, some bases
Mhm.
are not as good. But I didn't get a very good like I got my referral, which is why I went to the doctor, but I didn't feel like I got anything else out of it. And then I went
But
to
you
my
didn't feel like he listened to your concerns or really took into account your entire history that may
yeah.
your medical history.
Yeah,
Mhm,
especially, like, deploying to Afghanistan. I mean, the PACT Act had just come out, and I was,
mhm.
like, worried about all these things, and
Yeah,
I don't know if you know Kate Hendricks, she died of breast cancer, and,
I've heard of
like,
her.
her son was one of the people who was there when they signed it.
Mhm,
She was actually interviewed on the podcast,
mhm.
while she was
Sure, I heard of
struggling
her.
with yeah, and so, like yeah, so, like, those were, like, big concerns for me, and he didn't seem to have, like, the same concern or
Oh, wow.
understanding, and so
Mhm.
I was like, "Well, that wasn't very helpful," and
No,
so I was planning on switching from Prime to Standard, is that what it is? I'm like, I
Select,
don't
that's what I'm on. I'm on
Select.
Tricare Select because of that, issue, because I didn't feel like my voice was necessarily heard. It varied so much across installations that I did prefer Tricare Select,
Yeah.
where I could find a doctor who can listen to my concerns. Mhm,
Yeah, so that was my plan, um, this year to switch, but then I went to my VA health appointment because
mhm.
once you're registered in the VA, you're supposed to go every year to like do a yearly physical with your doctor. And it was the best appointment I have ever gone to. She explained not only like she didn't say they always are like your blood works looks great, but she explained to me what each section meant and like
Oh,
what
wow.
things she's looking for. And
Mhm.
then, like, they, talked about all the concerns I had and told me, like and they put in my record, things that we're watching for. I was able to get the referral to dermatology, and it was like I just left feeling, like, heard and, like,
Mhm.
taken care of, and I was like, "This is the greatest thing ever." So, like, yes, I have TRICARE, but that's, like, my, backup if there's an emergency and I have to go to the emergency room. I have insurance, and I'm planning on getting all my, like, healthcare through the VA because
Now, is this on the VA, the Women's Health Clinic? Because I know you talked about that.
yes, yes.
Okay.
Yes, I did. Yeah, so I'm going down to Long Beach because that's where the main there's another VA hospital in like downtown LA, which I'm not going to go there, but the closest VA hospital is in Long Beach and they have a VA health clinic. There's a few satellite clinics closer to my house, but they don't have a women's health clinic, and so it was recommended to me to go there, and so I would recommend that to any women veteran because it was amazing. Amazing care.
That is great to hear because that's the
Yeah.
one thing that we're always I know I'm cautious about whenever there's any type of healthcare is like, "Wait a minute, are they actually going to listen to me, when I have these concerns? Are they going to take the time, or is this gonna be the 15 minutes, let's check you out?" And, if it isn't acute, it's almost like you're being triaged. If it isn't acute, it isn't addressed versus having them look at that long-term goal. All right, we want you to stay as healthy as possible for as long as possible. And if we can prevent anything now or, look at anything and catch things as early as possible, like
Right.
your melanoma, to catch it at stage 0. I mean, that's the kind of thing that we dream of, right?
Right.
Oh, wow.
Yeah. Yeah, no, I mean, and the doctor was younger than me. She was like she wasn't a veteran, but she had a passion for helping veterans. And like, we had a whole hour to do the appointment. So like she wasn't rushed, and I was able to get all my questions answered, and like she spent all that time on like what each part of my blood work meant and why she
Wow.
wasn't worried about. She's like, she could have just said your blood work looks great, because that's
Mhm.
essentially what she said, but no, she went through like each number and explained why, like what we would be worried about and why. And then she was like, and these ones change like every 24 hours, so this one's a little high, but I'm not worried because all the rest of your blood work looks fine. And so it was such a great appointment.
You had me at the fact that you had an entire hour for the
Yeah.
appointment and you used that hour. That's
Yep.
almost unheard of, right? Where they give you
Yep.
an hour, but you're not with your doctor for an entire hour.
Oh no, yeah, you were with it. I mean, between the nurse tech and the doctor, it was an hour, but it
Mhm.
was like at least 30 to 40 minutes with the doctor.
So
So,
that's reason alone that people should attempt, especially our fellow women veterans, you should attempt to try to get registered in the VA healthcare system.
yeah.
Don't I liked how you talked about don't disqualify yourself. Have them tell you no and why they give you a no. You know,
And I was actually looking when I filed my claim, and my end of service date was actually connected to my IRR service and not my,
mhm,
like,
yes,
date I left active duty. So I actually did disqualify myself when I wasn't, like, it was 5 years and 1 month. I think I was still on IRR when I
mhm,
disqualified myself from service. So it was like, yeah, so that was not, so yeah, so even like my 10 years isn't up because I have, the date on my VA form is actually a few years after I left
mhm,
active duty. So
yes.
that's another thing to think
Most
about.
people that's an easy one to miss is our
Right.
actual IRR, because there's another letter that comes when it says that you have
Mhm.
satisfied your IRR, and I remember the day that that letter arrived, and I saved that one too because I know that's
Yeah.
the actual last day.
Yep.
That's a good tip. That is a good
Yeah,
tip
I
to
I
measure for
just
that day.
forgot about that.
Yes,
Yeah.
and it's okay, it's really easy to forget because it's not something that marks in our mind until you get that letter in the mail, like, "Oh, okay, cool.
Yeah. Well,
Alright."
yeah, because I'm thinking 10 years and it's, October 4th of next year, but that was just when I left active duty. That's not actually my 10-year window. So,
Now, one thing I was curious about is that relatively recently, we just had the deadline as of this recording, we had the deadline where you could turn in your intent to file, a claim for the PACT Act.
yeah.
How is that different from the disability claim?
No, that's the start of your disability claim. So
Okay.
your intent to file is saying, "I plan to file a disability claim," and in your intent to file, you put what areas that you're planning to have the VA look over, and then from that date of your intent to file, you have a year to, get all the paperwork submitted to the VA. And so I did my intent to file in October of last
Mhm.
year, and then it took me until April to get all my paperwork, like collected and then sent over to the VA rep and then submitted to the VA. And then I did my appointments in mostly in May, and then I had one last appointment in July, and then they made their decision. And the intent to file date is important. And the reason they were telling people to do it by, the anniversary date of when
Yes.
the PACT Act was signed was because your back pay or your payment date starts the day that you intend to file. So when I got my final disability claim compensation, it didn't start the day they made the decision. It went back all
Mhm.
the way to October. And if you did your intent to file in August before, I think it was August, before the PACT Act date was, then it'll go all the way back to when the PACT Act date was signed. So you'll be getting not only from your intent to file date, but it'll actually backdate to when the PACT Act was signed.
Now,
So
for those who missed the deadline,
yeah.
is there any recourse or any way for them to still be able to file?
You can still file your claim, but it's
Mhm.
just not gonna go back. it's going to go from the intent to file date and
Okay.
not go backwards to the date the PACT Act was signed.
Got it. So
And
it's
so,
never too late. You would still be, the ability to access that healthcare is still there. I think that's the one big thing. I want to make sure that any myths are dispelled as we're going
yeah,
through this, that folks, I know folks that, were the last minute procrastinators, or just folks that they disqualified themselves, right?
right.
And so they dragged their feet and then they felt, oh, well, I missed the deadline. There's no way. And I'm like, I don't think that's right.
No.
It means two different things, but you still can file.
Yeah, you can still file, you can still, yeah, the PACT Act is like forevermore, going forward. And actually, they just changed that, like, the backdating thing was like a 1 month thing. When I filed in October, I thought my date was October because they didn't, they didn't come out with that until in the summertime. And then they were like, oh, by the way, we're going to actually go all the way back to, and so, yeah, so that's like, and actually the things that I claim for, I got 0% for PACT Act related
Mhm.
things. So my intent to file date was November or October, and that was when my compensation goes back to, because the things that I filed for that were related to the PACT Act, I got 0%, and so it
Mhm.
didn't go back to that August date or October, July, August, so somewhere in that. I'm like, I can't remember. It was in the summer.
Yeah,
Yeah,
close enough. Close enough.
yeah. It
Um,
had to have been August because we were PCSing while they were advocating on Capitol Hill in
wow, that's an
2022.
emotional. I like that you have that emotion of the PCS to tie to that
Yeah.
memory. You'll never forget like that time. I remember here is the PCS, and you know,
Well, because I wanted to be on the steps of the Capitol, and I was moving it, like, I was leaving DC at, like, the time when I
yes,
wanted to be out, advocating. It was, like, the worst time
of
to leave,
course.
so
We
yeah,
never have a good time when it's time for a military move. Never,
yeah.
never. Um, you know, this is the season right now as we're recording this, and early fall into fall, when all of the services generally have their professional development conferences. And I love how they go through, as I look at the agendas, I see that they go through not just the policy that they have for the services, and how they execute their functions, but they also talk about access to care, things that benefits that they can access no matter what installation that they're at. Looking back after going through what you've been through, post separation, um, what do you think that they should cover? Do you think they should cover this during those professional development conferences? Because I find that the earlier you start documenting or understanding this process, the better, so that you're better prepared when you first transition out. So do you think that they should cover this? Into what depth should they cover this?
Oh, that's a good secondary question. Yeah, I feel like there's, like, DOD. Oh my, you can't see
Mhm.
my hand. There's
Yes.
DOD, and then there's, like, VA, veteran, like, I feel like there's this huge, like, see how my hands are far apart? They'd be farther apart, but they wouldn't be on the screen. But, like, there's this huge gap between people on active duty and the reserves, and I said reserves, in the reserve, and in on national in the National Guard, and then, all the veteran support agencies. And I feel like for the reserve and the National Guard, they're a little bit closer together. But I
Mhm.
really wish we would start talking to people on active duty about what's coming next, like what VSOs are available, the VA healthcare, and what those benefits are, and what you need to be doing today. And I think the main thing, it doesn't have to be like a deep dive. It just has to
Mhm.
be like, 30 minutes or an hour presentation saying, like, this is what VA healthcare is, this is what VA disability is, they're different. And then, just making people aware. And, like, you don't have to, it doesn't have to be super deep, because if they're going to hear this, like, over and over and over, it doesn't need to be like a huge deep dive. It's just something that they need to be aware of, so that they're ready. Because the hard part is, I feel like active duty people, and I was like them, are like, I don't need to worry about that. It's
Until
kind of,
something happens, and all of a sudden you're separating before you actually plan to do that.
yeah. And so, yeah, so I see, because I went to the Joint Women Leadership Symposium, and
Mhm.
I was on the stage. I was the only veteran representative, and I
Ooh,
understood. and I understood, like, the questions from the audience were all focused on, like, active duty issues, and I understand that, like, people are worried about their troops, and, like, going
Mhm.
to that conference, I learned about, like, the stress and the challenges that they're facing, but they weren't focused on the future because 'cause they're, focused so
So
much on,
mired
like.
in the present.
Yeah,
And it's that tunnel vision. But
yeah,
if you were in charge of anyone, either you're a mentor, you're a leader of some type at any level, you'd want to be aware of what this is, because at some point one of your troops is going to end up transitioning, and you want to make sure that they're getting that information. Even if you don't know everything about it, you should know
right,
it's somewhere there back in the nugget, and oh, wait a minute, I think I have a POC that I can direct you to that can
yeah.
get this information.
Yeah, so yeah, just understanding like what's there. And I even if you couched it as like, we're telling you this because you're going to have troops who are getting out and you need to know this so that you could tell them, then I think that would go over better because if you're saying like giving them a reason in the here and now of why they need to know this information, and like it is they do need to know it as commander so that they can tell their troops about it, but then they'll
Mhm,
also know it for themselves. So I
mhm.
think that's a good idea to
Oh,
couch it as, you need to know this because your troops are getting out and you need to make sure that you take care of them. And then they also learn the information for themselves.
see, I already have thought of another roadshow for you to do, where you can go. You can go to different installations and you can bring that up.
Yeah.
So, out of all of this that we've talked about today, we've covered quite a bit. The first thing that I think, if I had to summarize first, don't disqualify yourself. Go ahead, try to register, and then let them tell you no and why it's a no. Two, it's never too late to file a claim,
Yep.
and that it's okay to go ask for help. And then three, that if we can, to start, planting that seed for folks that are currently on active duty, that, hey, it's available. You don't need to know everything about this, but help your fellow veterans, that is available for them, and that, it's something that they should consider, because it's a benefit. It's a benefit that we've earned by our service to the country. So why would we leave that on the table? And it's something that we should, take advantage of while we can. Because even
Yeah.
if we don't have anything that's affecting us right now, we're still relatively young. We're not sure what it's going to look like in 20, 30 years. And you just want to make sure, if there was something that we have today that just worsens over time, or something that's discovered down the road, that, hey, we've already, we've looked into the resources and benefits that we were eligible for. Now it's time for us to take advantage of it.
Yeah, and I don't know if you've seen, I think it's called New Amsterdam, but it's a movie about the World War I veterans and what they faced when they came home, and
Mhm.
there wasn't a Veterans Administration, and they actually were the big advocates who fought for the World War II veterans to get, and so that movie is really good to see, like, why the VA is so important because of how the veterans were treated and the different challenges they faced. And it was really eye opening to learn that history of like what the, because, we've grown up, the VA's been there, and it's kind of like something we're like, oh yeah, the VA. But
Yeah.
if you learn like what it was like for World War I veterans, and I know it's a movie, but it's historically based and
Mhm.
it's really interesting to see like how they were treated and how their needs weren't met and there was nothing offered from the government. It was other veterans taking care of veterans, doctors who, left their practice to take care of veterans and like, couldn't even really survive because the veterans couldn't pay them, but they felt a responsibility to take care of the veterans who had
Mhm.
been like mangled or had all these issues. And so I think that that movie is so good for veterans to watch to realize like why the VA is important, why they need to, those veterans, they fought for you. Like they fought for World War II, but they really fought for you so that you would be taken care of in the future. They don't want what happened to them to happen to you. And so it's not like you're gaming the system or taking advantage, like,
Mhm.
you served our country, and these benefits are here for you, and you need to, you know, do the hard work. It's not easy. Do the hard work and get registered in the system if you have a disability or if you have something from your service that is affecting you today, do a disability claim and get the compensation that's there because you served your country and you need to be taken care of. And so that's how I really want to end it. It's so
That's
important. And
perfect. That is the
yeah,
perfect way to end today's interview. Is that call to action? Number one, watch party for New Amsterdam, and then number two, do the work. Do
yeah.
the work. Get registered. Take advantage of the benefits that our forebears, worked so hard and fought so hard that we have today.
Thank you so much for doing this
You're welcome. Thank you,
interview.
Amanda, for having me on and getting to turn the tables and interview you again.
Yeah, it was really fun. And if anyone is listening and they have questions about, because we were like at the, Air Force, like 40,000 foot
Oh,
level.
yeah.
But if you have questions, I'm happy to help. You just have to email me or send me a message on social media and I can help. I probably won't know the answer, but I can direct you to people who do know the answers
Mhm.
because it is really complicated and it can feel really overwhelming. But um, I really highly recommend that you take that step to do what you need to do, and I'm here to help you along the way.